Excuse me. I don't take sugar. Get me another one, please. Right. You call that clerking a patient? 3 lines. Unacceptable. Reclerk, please.
Yes, sirree.
And, Miss Shah, what exactly is the point in ordering all these drugs from a pharmacy and then not signing the patient's chart? And what are these scribbles? They could be milligrams, micrograms, microchips. We don't pay our pharmacy people overtime to decipher your hieroglyphics. So get it right. I'll be reviewing all the notes at the end of the day. It's a bit over the top, isn't it? No, I don't think so. I don't accept sloppy standards. You go for it. Cross the T's, dot the I's. I'd be paranoid too if I were you. Nice shoes, by the way. Good for you. Finally decide to splash out on yourself. 5 years old, suffering from vascular dementia. She has a history of multiple strokes causing right-side paralysis. She was admitted last night with trouble breathing, low BP, high pulse.
Beautiful. Julian Wells, Moira's husband.
Jet Naylor, cardiothoracic consultant. Miss Shaw?
She had a bad night. Not getting any sleep. Last night, the GP thought we should really head over.
Right, we've got a loud systolic murmur.
What can you do to help her?
Well, I think that we should consider an aortic valve replacement.
Yeah, the doctor mentioned that.
However, in your wife's case, I would strongly advise against it. Considering her past history of high blood pressure, clotting problems, strokes, you stand more chance of doing harm than good by operating. Treat with ACE inhibitors and diuretics with a view to taking a look later.
Later? You mean later today, or...?
Excuse me for a second.
Darling, hang on.
Replacing the valve could help her heart and help reduce the clotting that's affecting her brain.
Or, much more likely, you take her into theatre and the guide wire loosens the clot, causing yet another stroke.
Well, naturally, it's a calculated risk.
Well, lucky for the patient, it's me who has to take it.
Excuse me?
Miss Naylor. Yes.
At around 8 o'clock this morning, an intercity passenger train derailed just north of Holby, hit a local commuter train and crashed into the station platform. Needless to say, this occurred at the height of the rush hour. So we have a major mass casualty event on our hands, with casualty numbers potentially running into the hundreds. And we've been designated the nearest receiving hospital. This is how it's going to work. I'll be your theatre clinical commander. Sister Williams will be nurse commander. Miss Naylor will be in charge in Darwin, with Mr. Hope already on the ED, and Mr. Levy will stay in Keller. Most crucially, as we're expecting unprecedented numbers of patients today, AAU is designated the receiving ward and will perform as temporary emergency department. Now, all of us are going to be tested to our utmost limit today. Don't lose your heads. Thank you, everyone. See you on the ice. Mr. Spence.
Yeah. All right, I'm taking a quick response unit down to the site. Sputnik's already on board. I need one more volunteer.
Okay.
All right, grab your stuff. I'll see you in the ambulance bay in 5 minutes.
Mr. Malik, I trust you can hold the fort until I can allocate a consultant to you.
Absolutely.
Very good.
What do you mean I'm getting rid of the electives?
Somebody has to. I'm a surgeon. Don't you think I should be in theatre?
Oh, calm down, Nigella. If nobody clears the wards, then we won't be taking patients to theatre. Right. I want the entire theatre list cancelled. I want you to call all the outpatients and rebook them for next week. We're going to have to double up.
The nurses usually do that.
Off you go.
Got multiple rib fractures and aortic injury coming into Theatre 1, so I'm going to need you to sort out the suspected lung injury in Theatre 2. Start with a bronchoscopy and followed by a VATS.
Yes, I know.
Done. All electives have been cleared to St. Luke's.
Right, and just page me because I'll only be next door.
Yes, I know that too.
Yes, Mr. Hanssen. That's fine. Yeah. Okay, send them up. Thank you. Right, we've got a polytrauma with abdominal injury, suspected cardiac trauma with a sternal fracture. So we'll need a GS consultant. Could you page Mr. Havergill, please?
Miss Naylor. Moira Wells, remember her?
Of course.
I think she's getting worse and no one's doing anything.
This is Jim LaBelle, 38, straight from ED. BP's 90.
Miss Shah is going to be right with you.
5. Breathing deteriorated, so intubated downstairs. He drove the passenger train.
What is Mrs. Wells still doing here?
She's not an elective.
No, that hardly makes her top priority.
Well, that hasn't been established yet.
His pupils are tiny.
They breathalyzed it at the scene. Positive.
Great, that's all we need. Okay, let's do a CT scan and repeat bloods, please. If he's been drinking, then we're going to need a full tox screen. Let's get him into ITU as well. This has to remain highly confidential.
Can we just hang on a sec? He doesn't even smell of alcohol. He should have been vasodilated and flushed. This man is vasoconstricted and his extremities are cold, not warm.
Alcohol or not, if he's vasoconstricted and his extremities are cold, it's because he's losing blood.
Well, I think it's imperative to be certain.
Right, that's my next stop. Mrs. Wells, can you discharge her to an intermediate care facility?
No,
please?
not until we
Just do it!
What's next in theatre?
Patient with a head injury, vomiting blood with a possible tracheal injury. And yes, neuro are on their way down to check on the head injury before I proceed with the polytrauma.
And Mr. Jensen?
Been transferred to ITU post-op. Thank you, Mr. Douglas.
Yes, Moira Wells, patient number 552786. If you can squeeze her in at any point today, call me back. Thanks.
Please tell me that isn't the Mrs. Wells that you've transferred to St. Luke's.
No, can do. The upheaval would be too traumatic for her.
Are you questioning my judgment?
Oh, perish the thought.
So?
So I have cause to believe that the dementia is masking her pain levels and therefore the severity of her symptoms. And once we're done with today, we have the option to proceed with a transapical aortic valve replacement using keyhole surgery. It will cut down the risks that you mentioned and immeasurably improve the quality of her life. A major incident does not give us leeway to compromise other patients in our care.
Miss Naylor, Mrs. Lavell's here, Jim's wife. Well done. Full marks for presentation, but she's definitely not going into theatre today. As far as I can see, there's still no overwhelming evidence that she needs to be put through a surgical procedure at all. So be very careful giving anyone any false hopes, because it will be you who will have to disappoint them. Mr. Douglas, can you come with me, please? CT scan's back. Well, there's a small amount of blood around the descending aorta, but otherwise the intima is intact. It looks like a hemothorax.
Mrs. Lavelle, are you okay?
Left really early. We're both still asleep, Rosie and me. I usually get up to say goodbye to him. Will you be okay?
We're doing everything we can. There is something I should mention. I'm afraid he tested positive on the breathalyzer at the accident site.
Positive.
He's 80 over 50.
He's hypertensive. Let's get a chest drain in.
What's going on?
Get the kit, please. Could this be as a result of the alcohol consumption?
I'm telling you, no.
Mrs. Lavelle.
Got the rest of his notes up. Let me put her in the pram.
Mrs. Lavelle, I realise this is awkward, but I have to ask.
You don't understand. He wouldn't drink, there's no way.
Okay, but if he did, and I take him into theatre, he may vomit and aspirate his lungs, which
What's
could be
wrong
very
with you? I told you. You're not hearing me. He wouldn't drink because we're both alcoholics in recovery. We met in AA. He lost everything because of the drink, his job, his family, everything. He's been clean for 5 years. He would never, never go back.
Look, we've run a tox screen if there's been any kind
But
of...
still, the breathalyzer came back positive. Now, I should warn you, when he comes around, the police may want to talk to him.
Right, I get it. In one ear, out the other. Here, I'll take that.
Permission to speak? Come on. It's way too premature to determine. We haven't even had the tox screen back yet.
No, of course not, because the lab is chock-a-block today. Look, I can't afford to wait. I need to take him into theatre and sort him out before his heart gives way under the pressure. Hopefully, I can do it before the press get hold of this. Then she really will have something to stress out about.
But if you do it before you check him fully, then you could be making a big mistake. I think that there's something more going on.
Of course there is. There always is. You just heard. The guy used to be in AA. He has a history.
What, a history of confronting his addictions? Geez, hang the guy without a trial, why don't you?
People fall off the wagon all the time. Maybe that's why she's so defensive. You know, I'm just going to follow the medical evidence here, okay?
Your job is not just based on clinical facts. It's about reading people.
Tell you what, thank you for the tip. You do not need to teach me my job. Because if you were good enough, you'd be doing it.
Maybe, but not by default.
Whatever. You keep telling yourself that.
This happened just now. His vitals started dropping.
Oh, God. You weren't answering the page.
It's getting worse, isn't it?
There's an excessive amount of blood in the chest drain and bleeding around the insertion site.
Right, start pushing fluids. He's
What's
tachycardic.
going on?
Can you take Mrs. Lavelle out, please?
Look, I'm telling you, there's something else going on.
Can you just do as you're told?
As I'm told.
Starting carotid massage. Where are his bloods? They're not back yet. Yeah, because the lab's backed up. You have to chase these things.
What's going on?
Get her out!
Miss Shaw, please.
Vitals coming up. Let's prep him, take him to theatre. I'm not waiting any longer.
Miss Naylor, if you would.
I see. So, Yummy Mummy ran to complain about Big Bad Wolf.
I wouldn't put it like that.
How would you put it?
Your ward does not consist solely of your patients, you know.
My team should be supporting me today, not sniping at every decision I make.
So maybe you'd like to have a look at your idiosyncratic management style? Your team's support in future, not just today, could be rather more crucial than you think.
What exactly are you referring to?
I haven't mentioned it explicitly until now, because nothing's been decided officially, but I think it's fair that I should tell you. The SHA are looking to shut down Darwin and merge the department with St. James's. There's nothing on paper, but the idea's been mooted more than once. It goes without saying that everything you do today, good or bad, will be minutely scrutinized.
Well,
You might like to make sure that your team are there to back you up. You know what they say, be nice to people on the way up. You never know who you're going to meet on the way down.
Nurse.
Chet Naylor.
It's Nurse Tate.
Yes, Nurse Tate.
Jim Lavelle's tox screen has come back. I think you should take a look.
Where are we? We need to call the drugs agency as soon as possible.
I'll do it.
She's not back yet. What's wrong?
There's nothing wrong. She's obviously in a queue. We're so backed up today.
Yeah, but-
Look, Mr. Wells, I'm sure there's no cause for concern. She'll be here any minute, okay?
Okay.
They won't tell you anything.
Does your head in, doesn't it? Is your wife in theatre too?
If only. Dragging the feet. They say she's not in pain. I keep telling them. I know her better. I know she is. Still, what do I know, eh? I'm only the relative.
You didn't listen to me either.
Well, at least they're treating your husband.
But they still think he's to blame for it all.
What?
I keep trying to tell them I know him better than anyone. Just like you said, but everyone's looking for someone to blame, aren't they?
I'm sorry, I'm not with you.
So the breathalyzer was positive. So what? These things, they can malfunction or whatever, can't they?
What, you mean he was drinking?
Mrs. Lavelle, was your husband taking a drug called Bropoxin?
I think so. What's going on?
Let me see that.
Drugs trial? What drugs trial?
Bropoxin. It's a combined drug for blood pressure and antiplatelets, which would explain the extensive bleeding.
What are you talking about? He hasn't got any blood pressure problems that I know about.
Well, it's not registered yet. I found it through the drugs agency. Your husband was taking part in a drugs trial.
But why?
Maybe because you get paid for it. Look, there is good news. The tox screen came back negative for alcohol. The Bropoxin must have caused a positive on the breathalyzer.
Oh, I told you! I told you he wasn't drinking! Do you know what this means? You would have finished him!
Lucky we didn't operate on him when we were going to. Otherwise, he would have bled to death on the table.
MRI clarify the dog patch on the echo.
Yeah, were you even going to come back and talk to me?
Mr. Wells, please.
Not as important as him, is she?
However, it looks like the thickening of a ventricle, not a clot as we initially feared, so the outlook for an operation is quite positive.
When?
Well, I'll have to...
Just tell me when.
I will have to speak to my consultant and we will come to a decision in the next few days.
Oh, here we go, in a few days.
Mr. Wells, it's important to remember that your wife is stable. She's not suffering.
Oh, and you're sat in her head, are you? I'm the one who's been looking after her. all this time? Not you, not anyone else. Me, because no one else gives a toss.
Mr. Wells.
So don't give me your platitudes. I'm not a kid.
What is going on here?
I'll tell you what's going on. She thinks my wife should have the op, and you're too busy to rub a stamp it.
What have you been promising?
Can we just hang on here, please?
A joke. A joke! Dragging your feet over her when you've got the whole hospital running round after him. A bloody drunk who killed all these people.
Mr. Wells, you need to calm down.
Calm down, I know. His bloody wife told me.
Mr. Wells, you need to stop this.
You stuck-up cow treating people like us just used to shut up and put up with no more.
I'll sort this out, it's fine.
Oh, God. I'm sorry. I'm so sorry.
Fair play to you. At least you got in the line of fire. You should have used your heels.
You can say it.
What? Saying nothing, me.
Oh, I had it coming. Wait till Hanssen hears about this, which she's bound to when she runs to him again.
She's a good doctor. You two should join forces. Can make life easier.
No, I don't see that happening. We're too different.
You think?
Come in.
Jim Lavelle's echo results.
Right, the bleeding on the X-ray disguised an aortic transection. Must have been caused by blunt trauma from the train crash. Okay, prep him. We need to take him to theatre straight away, inform the anaesthetist of a gaseous induction and make sure they've got frozen plasma and FFP to counter the Ripoxin.
Aortic transection. I think that's someone's specialty.
I think you can leave us now.
I don't know what came over me. I mean, I've never...
When was the last time you had a proper meal? Or a proper rest? How are you supposed to look after her if you can't even look after yourself?
You know, if she wants to press charges, I'll understand.
I'm sure she's had worse.
Jim Lavelle.
I heard. Aortic transection.
Well, Mr. Douglas is needed in AAU, so you'll be going in with me.
Oh.
I don't beg.
Even though it would really make my year.
Don't push it. Oh, and one more thing. I'm going to be debriefing tomorrow, which means that you'll have to take Maura Wells into theatre for a keyhole aortic replacement.
Your daughter is...
Good work in there. Can I have the post-op notes in by the end of the night, and can you make them legible this time? At least you don't dot your I's with hearts.
So, you've survived intact?
Yes, we have.
Good. Well, my public awaits. As you were.